Hey there, Dr. Tiffany Jackson here from Ecohealth Wellness Center and Detox Spa, and I am speaking out to all of my highly motivated, high-performing women, especially in business, entrepreneurs. Those are the people I really enjoy working with, and I have a specific program that I have designed for you because I know exactly how you feel and how certain symptoms are showing up in your world, especially when it comes to your health. From one high performing person to another, you go, and then you just hit burnout, and it shows up in a lot of different ways. I particularly like to work with women between the ages of 40 and 60 that are also experiencing hormonal issues. So as we're pushing through life and, balancing kids and work and travel and just the stresses of life, our bodies react in different ways. And it shows up differently for different women. And I have been in practice now for over 10 years. I've had Ecohealth Wellness Center and Detox Spa, and I've seen hundreds of women. And I really feel like I've figured this all out. So I've designed a specific program for my high achieving, high performing women. And I really like to work with business owners and entrepreneurs and, people that really are into business, because I'm in that as well. And when they come to see me, it's very enjoyable because I relate with all of their symptoms that they're going through. And but I also enjoy working with moms. I have some high achieving moms out there that are really, they kick butt, and they really push the limit when it comes to taking care of their bodies and going the extra mile to get well. It does take effort. It's not going to happen overnight. It's work. You have to really understand a lot about the body, and you have to understand nutritional deficiencies. You have to understand hormone balance. You have to understand your adrenals and how they function, because most of my high performing, high achieving women are adrenally fatigued, and that throws a lot of things off. And then on top of that, they have hormone issues. They're nutritionally deficient. We have a lot of underlying chronic inflammation going on. So, and then that is exacerbated because of an underlying major gut issue that has never ever really been treated properly. And so what I do, and so what I want to do is break this down a little bit and let you know, if you are experiencing certain symptoms, this is what is showing up, and why you need a comprehensive approach. So a lot of my women come to me and they are very bloated. They sometimes tell me they feel like they're pregnant every time. They wake up with a flat stomach, but by the end of the day, they have to unbutton their pants. They feel uncomfortable in their clothes. They feel puffy. They just, can't figure out what foods they're reacting to. Is it food related? Is it because they're drinking too much water? They don't know. They've been bouncing around to a bunch of different doctors. And so for my women, I usually find that they have underlying gut issues. They have a digestion and absorption problem. They're not assimilating and breaking down certain proteins and carbohydrates and fats. A lot of times they have a gallbladder issue where they're not absorbing fats, and that's causing a lot of excess gas, a lot of loose stool. A lot of my women are more constipated. That's more diet related. They don't have enough fiber, or, they're just not, the motility wise, they've lost kind of the muscle motility movement across the intestines. That's pretty common too. But, if you're a woman out there experiencing a lot of these gut problems, you need to reassess what's going on, with absorption and digestion. And, look at food sensitivities. Could you possibly be sensitive to certain foods? I commonly see dairy and wheat and eggs. We do a food sensitivity test to rule that out. Another thing I commonly see with a lot of the women that I work with is IBS. So, we're constipated for 4 or 5 days, and then they'll have loose stools and it comes and goes and they can't figure it out, and they've been to 5 or 6 different specialists, and all their doctors tell them that they're not allergic to any foods and diet has nothing to do with their symptoms, and here's some Miralax and they're on their way, and then just keep experiencing the same issues for the next 3 or 4 years. So until they find someone like myself or do a lot more digging. So the gut picture is a huge piece of what's going on and what we need to fix. So another way, with a lot of my women, they're just exhausted, fatigued, burnout. I hear it over and over and over again, and they want to give up. It's sometimes pretty sad. And I'm like, okay, no, I'm throwing you a rope. Here's your life raft. Like, I got you. I'm going to bring you back in. We just need to figure out what's going on, what's causing the fatigue. They've been to dozens of doctors and they're all telling them they're normal. This is just a part of you got 2 kids, you're normal, or, here's an antidepressant. It's just a season of your life. And, no, we don't look at it that way at all. Fatigue, usually I will discover a lot of my women have iron deficiency, B12 deficiency, vitamin D deficiency. We will find adrenal fatigue. We will find thyroid issues. Those are huge things that need a comprehensive assessment. If you are a high achieving woman, working your tail off and burning the candle at both ends, and don't let your doctor tell you that you're just fatigued just because, and that's a part of life these days. You can feel better. Hormones need to be assessed as well. So one thing I hear a lot from women, and if you feel like this, you can't drink alcohol anymore. You're at a point where it's like, oh, I can't even have 3 sips of wine or I'm going to pay for it. Or if I drink a beer, I pay for it for 2 days. You're having a problem with metabolizing and breaking down alcohol, which is liver related. You probably have some underlying gut bug or infection, bacteria or fungus going on. So when you feed it and fuel it alcohol, sugar, these gut bugs that are part of your ecosystem just go crazy. And then it causes extreme brain fog, fatigue, bloating. I hear it all the time with patients and my high achieving women. And that's just because I think, socially, we are out and being social and, drinking different cocktails and beers with people because we're go. And we know business, and part of doing that, there's a balance in it. But if you do it too much and your health starts to decline, you become way more sensitive to the alcohol. So, if that's you, I can totally help in that department. A lot of my women too also, they're just like, I'm in a brain fog. I just feel like I've hit the wall when it comes to focusing and my mental clarity, and, I just want my brain back. So a lot of that with my experience is hormones, and then also nutrient deficiencies, and then also some gut bugs going on, particularly candida. So, and that off gases, and it just causes it's kind of like this formaldehyde off gassing and just creating toxicity in the brain. And until we clean up the gut issue and correct some of these nutritional deficiencies, then it's really hard to focus and get things back. People mask it with all sorts of different meds, but we're here to get to the root of the cause and not just mask the symptoms. A couple other things that show up in a lot of my women out there, that I call them high performing women, because these women just work so hard, and they're in big companies, they're, realtors, they're attorneys, they're CEOs, they travel a lot, they are entrepreneurs, they've been, pushing themselves and worked really hard to get to where they are. And, I see on the other end, like, how their health just kind of declines, and they have a very strong outer shell where you would never know. They look so healthy. And when they come in my office and I meet them, and I'm like, oh my gosh, if I wouldn't have just read everything that was wrong with you on your new patient work. Like, you would look at them and meet them and never know how broken and sick they are on the inside. And it's just years of depletion and exhaustion, and no doctor's really taken them seriously. And, you see that, and it shows up with their skin. And a lot of times, so women, they cover it up really good, but they'll have underlying psoriasis and eczema and, patches along their torso, or there's stuff going on, underneath. A lot of my women have had lots of just random rashes, and it's not the number one thing that I see, but it does show up enough to where, I'm chronically seeing these underlying, random skin rashes that have never been really diagnosed. Some will say, oh, I went to the dermatologist. They don't know what it is. They, it comes and goes. They can't figure it out. So it doesn't really have a name. Or they say, yeah, I've had a history of eczema, but they've used some creams and, it's only worse in the winter. So, if that's you, it's another part of your immune system and being suppressed, and you just being a little bit depleted. It's another adrenal picture, liver. It's looking at the body as a whole. And then the last couple things that I see a lot in my women is anxiety. And it's a big deal. And it's people check the box when they fill out my paperwork about anxiety. And, I always have to ask, so how does that show up for you? What does that mean for you? Anxiety is different for different people. Is it are you having panic attacks? Are you, just feel tight in the chest? Do you feel like your neck gets tight? You have problems swallowing? Is it more just a mental thing? Is it your brain racing, and, or do you actually break out into a sweat? Physiologically, it shows up a lot of different ways for people. And on a personal note, I had debilitating anxiety it's been 15 years ago. It was right after I graduated naturopathic medical school, to the point, literally, I was having massive panic attacks and pulling over on the side of the road, calling 911, thinking I was going to die. Like, it was not okay. So I totally relate to the anxiety portion of, feeling totally exhausted and in fear of dying, because my body literally would go numb, and my tongue would tingle, and my face would get all like tingly, and I couldn't swallow, and then I would just get really dizzy, and I feel like I was going to pass out, and I feel like my just heart was going to stop. It's the worst sense of doom ever. So I've been there. I've had the anxiety. I've had the skin stuff. I've had the adrenal fatigue. I pretty much, big man upstairs makes me go through everything, so I can relate better and help you. I swear. That's been my theory, at least, through all this. So I got you with the anxiety department. A lot of it is total nutritional depletion. So that was the way I was able to help myself. And it's amino acid balance, it's neurotransmitters, it's gut health. There's so many different pieces to it. So, the anxiety part of it is scary, really scary. And I see it with my patients, and I know where you're at with that. So that's one thing we can totally address when you're on the program. And then last but not least is the weight gain. I do see a lot of women, here we are, they've been exercising. A lot of my, motivating, high achieving, high performing women, they exercise. I mean, they haven't had a problem in this department. I mean, they're pretty go-getter type people that, they go to the extreme sometime. And I think that's where it comes back to bite them. They've really pushed the limits so hard where they over exercise. And now they've their body's gone into the survival mode, where the body, because it's under so much chronic stress, it's just not able to really reset and heal. And it's an adrenal thing. It's an adrenal fatigue. It's actually an amazing survival mechanism that the body goes through. So if you find yourself like gaining weight and you're exercising like crazy, but you can't get the weight off, or, you're overdoing it and your body's holding on to everything, and you're not going to be able to lose the weight until we fix a lot of the underlying adrenal issues, nutritional issues, gut issues, balance your hormones. You're just going to be stuck. So I hate to be the bearer of bad news, but I've seen it so many times with my patients. You gotta reel back in the exercise. Even though I know you're getting this euphoric, like amazing feeling right after you exercise, but then you just crash later. Your body can't keep up. So, we find a balance in it. We do different types of exercises that I recommend to patients, and then we get your adrenals rebuilt back up. It's not that you can never exercise again. We just need a little break to help get your body back in balance, and so you can get back to work and kicking ass at everything that you do. It's just kind of taking a little break. So that's the weight part, and then the frustration. I see most of my patients, they get really upset. We keep tissues in the consult room, because by the time people get to me, it's been like a part-time job of them going to a bunch of different specialists and doctors and going to get labs, and they're just trying to figure themselves out, and they are exhausted, so tired, and they're actually really pissed too, because these are smart women, and they think, and they've put their trust in a lot of these other doctors who they thought were really smart and that were going to help them, and they have failed them in every way. They've told them their labs are normal over and over. They've told them there's nothing they can do, and then they try to just research online and Google and figure it out themselves. They're smart women. They're not going to give up. And so by the time they get to me, they're just like, help me, tell me what to do. Like, and my friend of a friend told me that you helped them, and what do I need to do? So what do? I do extensive comprehensive blood work, because nobody's taken the time to put all the pieces together. So we do that. It is the biggest blood work panel you've probably ever had, and I look at everything from your thyroid to cholesterol to vitamin and mineral deficiencies to the adrenals to chronic underlying inflammation, autoimmune, celiac, vitamin and minerals. I think I just said that, but it's very comprehensive. I got to get a snapshot of what's going on in your body. So then from there, you fill out pretty extensive paperwork, and then we meet. And I play detective, and I pull the pieces together and start prioritizing what we need to do to get you well. It's different for everybody. Some people we need to start with the hormones first. Some people we need to start with the gut first. Some people we just really need to fill up the tank with, correcting underlying iron deficiency and B12. And, even if people have told you and other doctors have told you that your iron levels are normal, I'm still going to want to see them on mine, because I have an optimal level that I look at. I want you in the optimal range, not in the suboptimal or almost deficient. So women, and that's going to change if you're cycling. So you're constantly losing blood. So we need to look at patterns. We need to look at your cycle. And most people, the week or two before their period, the week before is when their symptoms are exacerbated and they feel awful. So we're looking at that part of the cycle with progesterone, and, there's so many different pieces of it. I got you. Get off the internet, pick up the phone, or send an email and call me to learn more about my 12-week program. All right, that's it in a nutshell. Stay tuned. I'll be back soon.